All right, so welcome to this presentation on One Health. Um, like I've already said, that One Health um, is one of the modules that we are going to introduce to our program of Bachelors of Public Health, and also we shall have it as one of the components in the other health-related programs, such that everyone has an understanding of the approach One Health. For countries that have really recognized the importance of One Health, they have gone ahead to have even undergraduate programs such as bachelors of One Health approaches or bachelors of One Health. So if you see a program called Bachelors of One Health, just know that it's what we are going to introduce ourselves to. On the screen, you see an image of, it's just a screenshot of an article written on 7th of September 2023, which is about almost 3 months now. So the article is not old. The article is about farmers using ARVs to feed their pigs. This is in Uganda. So this article is in the East African newspaper. So we shall refer to this article later on, but basically this article has two things that I want to highlight at this moment. The relationship between animals and humans is something that this article picks. Perhaps during our explanations, we shall have more understanding about it. So in this session, we should be able to know what One Health is, why is it important, what makes up One Health, and what are the global health challenges that can be addressed using the One Health approach. And then we shall also look at what are those things that make the interaction between animals and humans to increase. So those are the objectives of this session. One Health is an approach that recognizes the interconnection of animals, humans, and the environment. Okay, it aims at promoting the health of humans and the health of the ecosystems, or what you can call environmental health. Okay, so what we basically have here is that One Health recognizes that animal health impacts on human health, and then humans also have an impact on the environment, and the environment has an impact on humans, and the humans have an impact on animals, and the animals have an impact on the environment, and then the environment has an impact on the animal. So this interconnection is what is actually emphasized in One Health, is that the humans, or our health, human health, does not exist in isolation, but is interconnected with animal health, ecosystem health or environmental health. Okay, and we have each impacting on one another in different ways, on different mechanisms. The picture that you see on your screen is one that is actually that depicts the interconnection of the three domains: the animals, the humans, and then the environment. What you see in the environment, the water is conspicuous. It's like you you can easily see the water. um, I don't know whether it is a well or it is stagnant water, I can't tell. But you see that we have animals there, we have humans, it closely, humans that are closer with animals, and then you can see the source of water, you can see the housing, the nature of the housing that you see. You also see the vegetation, the plants behind or the trees behind there. So this is it illustrates that One Health approach, or the concept of One Health. That picture, even when you look around where you're staying, this picture is actually there. You will see this around your place. You will see that you have either cows, or you have goats, or you have sheep, and then you have, maybe it could be a kraal, it could be an open place where you're keeping this and it's not distant away from home. So and then you get milk from these cows. So there is that interconnection in different mechanisms, whether through the milk, whether through the hide, whether through having them as pets. You can have cats as a pet. You can have a dog, interact with the dog in different ways. Sometimes it actually sleeps in the same room like with you. A lot of things, okay? So when we talk about animals, we talk about all these: the cows, the sheep, the goat, the cats, the dogs, all these. And then we also talk about the wild animals also. So the emphasis here still is that we have what we call we have what we call the third law of motion by Newton, kind of acting between ecosystem health, human health, and animal health. That law states that action is equal but opposite. Action is equal but opposite. This is to say that um, in this context, is that when humans destroy the environment, for example, okay, if for example humans carry out deforestation, the environment will respond in an equal but opposite measure. That you have desertification, for example, you have soil erosion, you will have all the things happening. Okay, so in either way, the interaction between these three domains they have impact on each other, like I explained earlier on, where the environment has impact on humans, on human health, and then humans have an impact on the environment. So this means that it is very important for us to recognize that everything that we do will have an impact. As humans, will have an impact in either the environment or the animals, or actually both at the same time. Okay, so we need to be cognizant of that. So the humans, we are actually growing in population, in number. We are clocking Uh, we are now at 7 billion, but it's very likely that we shall clock 9 billion by mid 21st century. A lot of things are happening, or humans are doing a lot of things. There's great movement. Rural areas are becoming urban areas. There is increase in trade. You are in South Sudan, you buy things from China. You're traveling to China anytime you want. So humans are moving at a very, motility is very high because of the improved means of transport and also technology. But this creates a very high potential for spread of infectious diseases. So that's the challenge with all the things that are happening within the human domain. The other problems that we also experience is, of course, in terms of health, is that yes, we are having more people growing up, I mean, living for many years than before. Life expectancies has been increasing over the years. So we are having an aging population across the different continents. But we also have people who are also having immunocompromisation. Of course, these seniors also, when they age, they require chronic care, but also their immunity also goes down. But also have people who have, for example, people staying with HIV. So we have their immunity compromised. And then you have unprecedented inequality, access to resources, poverty. People are becoming more poor. The rich, of course, are becoming more richer. And then you also have infectious diseases that are emerging, COVID-19, for example. And then also at the same time, we have the non-communicable diseases. Okay. And then on top of that, we have mental health, which is actually mental disorders, which are underreported, or even not really given the priority that it deserves. Okay, so the humans are having a lot of things happening. Like I've said, we are having a lot of movements. That means that the rate at which we interact with one another is increased. And that also means that the rate at which infections can spread from one continent to the other is also increased. Okay, but as a result of increase in population, we are destroying the environment, or we are encroaching more on wildlife. Okay, and therefore we are impacting on animals as well as impacting on the environment. So, of course, we use animals for protein, the source of food for those who, the hunters and those who rear actually animals or cattle. Okay, so food animal production is actually increasing. Okay, a lot of things are happening, and for example, this takes us to the first slide that we had, which talks about ARVs in pigs. Okay, because people want to meet the demand for pork, they want their piglets to grow faster, so they give them ARVs. And the impact of these ARVs in humans is not something that we can really say it is positive. Definitely, it should be having negative impact. But what negative health impact, we really don't know at the moment. Okay. Um, you could think about diverting ARVs for humans to pork, and I mean to pigs. This creates a shortage definitely for people who may need these ARVs and availing them to pigs. Um, and definitely this is in an economic sense, it is loss, okay, to the government that procures these ARVs, okay. So that increase in demand for animal products makes people go to the extreme, okay. So we also have, if you're basically looking at the domestic animals, we are also looking at the things like which also I'm very sure some of you might have concern over, Brazilian chicken. There are those who really have negative perception about that. But also the other thing about Brazilian chicken is the illustration of how trade has really changed. Okay, we we are in Juba, but we eat chicken that comes from Brazil. We are in Juba, but when you go to our supermarkets, you will see oranges, apples that come from South Africa. Okay, but still, let's go back to animal products. Animals reared in a different continent, or the birds reared in a different continent, in this case, Brazil, and brought to Africa. And that's what we are consuming. This also is an illustration of how interconnected we are as a global village. Okay? So that means that if we get a zoonotic condition associated with chicken in Brazil, us who are in South Sudan are also likely to get it, because we basically import those things from that end. Okay, so that is the animal domain. I've used an illustration of domesticated animals, but we also have the wild animal part, the hunting that happens. For example, Ebola is associated with bats. It's associated with the hunters in Congo. And then also we have other conditions, influenza, rabies. These are all conditions that affect humans that are from animals. Okay. So in here, we are looking at this one supposed to be environmental domain. But you see, the environment harbors a number of living organisms. And the moment we destroy the environment by either bush burning, by deforestation, by pollution, these animals will lose their habitat. Okay, these animals will actually die, and they will be reduced to biodiversity. These living organisms play an important role within the ecosystem. Okay, so activities that actually impact on the environment will eventually have an impact on human health. So that is why it is very important to conserve the environment and restore the natural resources and ecosystems. In our country, we can't talk about environmental issues without mentioning about the water bottles, without also mentioning about the oil spillage. Waste products from petroleum contaminating some of the water sources. in the oil drilling states of South Sudan. Okay, so these have impact. This pollution has impact on the animals, has an impact on humans, has an impact on the plants. Okay. Recently, there was an article in Uganda about rice. That the rice that, regardless of whether that rice is imported or whether it is grown in Uganda, the samples that were taken from this rice indicate that they contain arsenic, and arsenic is poisonous. Okay, so this also indicates that because much of our rice comes through Uganda, definitely, even us in South Sudan, we are having this problem of rice that is contaminated with arsenic. But the other problem that is there, that research showed, that even when you wash, okay, washing can help reduce the content of arsenic, but again, even the water that you use for washing also contains arsenic, the tapped water. So that means that the reliable, perhaps in quotes, the way in which you can really reduce the arsenic content in this rice is by using rainwater to wash it. Okay, but also the other advice was that, okay, maybe you need to reduce the rate of consumption of rice. Okay, so we have seen generally that the environment, humans, and the animals interact with one another. And some of the global health problems that we face are actually linked to these domains that we have discussed. So what is exactly happening? We have climatic change or climate change. Climate change, as you see from the diagram or from the image, we have increase in carbon dioxide, CO2. This comes from a number of things. One, industrialization. Two, because of deforestation. Okay. And because of these activities, deforestation, for example, swamp reclamation, we lose biodiversity, we lose animal habitat. Okay. And then also have humans that encroach on either forests, either swamps, even rivers. In one of the beaches, what they were doing in order to construct some more structures along the lake, that the constructor is trying to fill the lake with sand so that they can have space for them to construct. That is an example of encroachment. So we have encroachments on game reserves, encroachment on swamps, encroachment on water bodies. Okay. So these, of course, together with industrialization and mineral exploration, cause environmental contamination. Okay. You can see this tank here. This is an oil tank. It happened recently in Juba. I think it was not 3 months ago, when we had a ship that had gallons of oil or petroleum subsidized, and then we had this spillage into the Nile. And then one of the water bottling companies was actually getting that water with that oil in it and actually bottling it and selling it. And people made a lot of noise on social media. Okay. So oil spillage into water bodies, you can see that. And then we also have water and food security threats and safety issues. The safety issues to do with the extent to which we use pesticides. Mm. Some of these things are actually in the news a lot. For example, you see it was still in Uganda where a pesticide which was deemed to be unfit in one of the European countries were actually being used in Uganda for crops. Okay, so we eat greens and we don't know which pesticides they actually used. What is the To what extent do we have these pesticides in these vegetables? We actually don't know. So we have issues to do with food safety and then also food security and then water safety also. Another problem is the antimicrobial resistance. This is a very big problem, and actually WHO recognizes it as one of the biggest problems of this generation. It's a silent problem, but the moment it will actually blow, it will have catastrophic impact. Okay, so people are not using antimicrobial drugs in the appropriate way. And then here comes the animals. We know that uh, we have diseases that come from animals to humans, brucellosis. Even COVID-19 is attributed to animals, and then also Ebola and many other conditions. The socio-economic and cultural environments actually changing. This is the way we live is actually changing. Issues to do with the jobs that we do, the methods of transportation that we have, the foods that we eat, the social interactions, the cultural practices, all things are actually turning, they are changing. Socio-economic transformations usually associated with changes in diet. Okay, the day you get a job of 2,000 US dollars, you say you don't want to eat full masir. So you want to eat meat, you want to eat high, what you can call in quotes, high-end foods, the foods that indicate your status. And then this leads you to cardiovascular conditions. Okay, so basically those are the things that we talk about when talking about social economic and cultural environments that are greatly changing. Our workplaces, where we stay, all the things have impact on our lives. So, having known those dimensions and how they influence health and the problems that we are facing, which are enormous, how do we really address them? The first thing is to recognize that, you see, there is no linear problem. There is no linear problem, and you should know this, that you don't have A causing B and that is it. You will have B caused by D and caused by E and caused by F and caused by another factor. So it is not a linear thing. You have a lot of factors that contribute to a given health state. So that means that if you understand this complexity, you cannot solve a problem that you don't know. If you know that the problem is complex, that's when you can actually devise the appropriate ways to solve it. And this now requires interdependence. This is the element of collaboration, that you see the health system is not a system that is a standalone system, that is not impacted by other sectors. So the health system is impacted by the agriculture sector, which has the animal and then the animal production, the crop production element. Is also impacted by the socio-economic activities taking place. The different policies that affect the economy have an impact. So that is the first point, is that the health system that can address the problems of this generation need to be, you need to have that understanding that the health system is not going to be alone. It has to depend on the other sectors, the transport sector, the agricultural sector, the finance or the economic sector, whatever you can call it, the impact on the health system. So that means that if you're going to address problems in health, you need to bring all these people on board. So you need different sectors, you need different stakeholders, you need different perspectives. Okay? If a child comes to a hospital with malaria, a doctor will think about antisunate. A public health person will think about a mosquito net, will think about prophylaxis, will think about cleaning the environment. These are different perspectives. The doctor will think about the medical approach. The public health person will think in terms of the psycho-social approach. So different people have different perspectives, and they need to come together to address this problem of malaria, for example. Okay. The other point is that health problems can be addressed at different levels: national, local, and also at a global level. I cannot overemphasize the transdisciplinary nature of addressing problems through the One Health approach. Okay. For you to address the problems caused, for example, if for example, you have an increase in the number of cases for brucellosis, you cannot address that problem alone. Of course, you will need the clinicians, you will need the public health people, you will also need social scientists and other people in order to address the problem. So you have different disciplines coming together to address the issue. That is the transdisciplinary nature of One Health. And then the systems thinking, which is also very important, is that you see, for a person to get, for example, brucellosis, what is the complete picture of how this person actually contracted this brucellosis? This is to say that you need to look at the whole picture. Don't only look at the fact that, okay, this person perhaps consumed milk that was contaminated and was not well cooked. That may not be enough. So with systems thinking, you need to think about the different actors that could be interested in the problem and how they can actually address the problem. What is their approach? What are their perspectives? What resources could they be having? So that is what you call systems thinking. It is not one dimensional, but it's looking at the whole system as a whole. Okay, it comes from what we call, you see, if you have if let us say, if you have a computer, a computer has different parts, okay? But for it to work, everything has to be in place, okay? So when you have that kind of thinking, it helps in addressing some of these problems. You are able to know the roles that different factors play in contributing to a particular health condition. And then information sharing and communication. Social scientists need to be able to communicate to doctors. Doctors need to be able to communicate to nurses. Doctors need to be able to communicate to public health people, to counselors, and everything. Okay? Just remember the fact that for you to address a problem, you need to work as a team. Okay? You need to work as a team. This is one of the principles of One Health, that you cannot address one a problem as a group of people from one discipline. Okay, for example, if you if you if you discover that people are not using pit latrines, and then in your quick assessment say maybe they don't have them, so let us dig the pit latrines, and then you dig them and then all of a sudden they can't use them. Okay, one of the issues could be that you did not really incorporate different perspectives or the different disciplines in how to actually deal with the problem. You will have what you call behavioral scientists who will interpret these behaviors of people who don't want to use pit latrines and how to change their behavior into using the pit latrines. This is information that perhaps you may not be aware of. Okay, so that's why communication between the different teams is very important, and sharing information is vital. And then the last part, or the last principle, is the evaluating the impacts and outcomes of interventions. Yes, the issue here is that I think as a country we have not yet really embraced One Health approach, and it's very visible when you are in some of these meetings. If you sit in a meeting, and I know most of you have had this opportunity to sit in meetings where we have clinic officers, you have nurses, midwives, doctors. There is that tendency for the doctors to dominate the talk, and then the other health professionals taking a back seat. Okay? That does not encourage information sharing and communication. Okay, people should be viewed as people who can really contribute towards solving a problem. There are some problems where you can have clinic officers as the front people, okay, the on ground people deal with the problem, and then you have others uh, doing the planning and coordination, things like that. So I was emphasizing that as a country we have not yet embraced One Health, and perhaps people are ignorant about it. But one of the things that can be done to make sure that people really understand the importance of using One Health is, if for every interventions that we actually use the One Health approach, we evaluate the results of the intervention and then being able to share these findings with politicians, policymakers, and things like that. Perhaps this will change people's mindsets towards applying the One Health approach. So that's why evaluation of impact of and outcomes of the interventions is very, very key. And in one of the sessions that we shall have in this module, is we shall look at the different case studies where One Health approach has been applied. And you really understand the importance of evaluating interventions. So different disciplines, whether it is veterinary doctors, public health, social scientists, psychologists, people, ecologists, doctors, nurses, clinical officers, microbiologists, lab technicians, health system experts or health economics experts, molecular epidemiologists, a lot. All these people should come together and be able to address the problems that affect human health. So, what is the history of One Health concept? The recognition of the importance of animal and environment in influencing human health dates back ancient civilizations. But the issue is that over the years, people had not really taken a lot of interest in applying One Health approach. So that's why it actually appears like a new concept. But it's a concept that has always existed for years. But at the moment, it is the um, it is a perspective that has actually gained a lot of attention. So One Health is the approach to use to address the problems that we face. The things that have happened, for example, the outbreak of COVID-19, the SARS, avian influenza, Ebola, these things have demonstrated that yes, we are interconnected with animals. And to be able to address problems caused by these zoonotic conditions, it's very, very pertinent that we use the One Health approach. So what do we use in applying the One Health approach? You need to understand what conditions are emerging, which conditions are re-emerging. So you need to do surveillance and monitoring. Of course, this will generate data that you can use to really simplify data and people to understand the trends, the patterns. Okay, and then generate insights. And then the other thing is risk assessment. Okay, we have different exposures from either from the environment or from the animals. All the exposures that animals actually get. I've been using a lot of the examples in terms of human health, but is perhaps if it is a veterinary doctor giving this presentation, they will also focus a lot on animals. Okay, so the risk assessment is not only on humans, but it's also very important in animals. Okay, because humans feed on these animals. So if animals are exposed, let us say, to poisonous minerals, or they have been fed on pasture that is poisonous or that contains um, um, a long-term pesticide, what risk will the humans have if they consume meat from these animals? Or what risk would there be would be there in animals if they consumed or if they're exposed to particular exposure? So risk assessment is very, very key. And then communication and coordination platforms. Um, this goes back to, to what we said earlier on. Um, we need to have veterinary doctors, agronomists. We need to have human doctors or human medicine professionals, where you have all these professionals under that, having a way they can share information. So there should be a coordination platform that facilitates information sharing. The other thing is, of course, we need to train people to know the concepts of One Health. And that's why this presentation is actually very important today, that all of you should actually attend and at least have an idea about One Health. It's part of the capacity building and training to open up your minds about the problems that we actually face. And then, of course, continuously conduct research and innovation to generate new knowledge and get solutions to the problems that we face. So, One Health is not a single concept or model, but rather a collection of approaches and frameworks that share the common vision of improving health outcomes for animals, humans, and ecosystems. And we are going to look at these broad approaches: eco health, planetary health, global health, um security. When we talk about eco health, we are basically emphasizing the importance of the environmental health, okay, where we have living organisms living in an ecosystem that is very complex, interacting with one another in non-linear ways. Our emphasis is to promote eco-conservation such that we don't cause disruption. Disruptions will cause loss of the biodiversity, will cause, of course, environmental degradation will result into issues that will impact on our ability to even grow crops. Environmental degradation can result into soil erosion, for example. We can also have uh, leaching of minerals, okay, and then you have soil that is actually infertile. Okay, so ecosystems, eco health is about protecting the ecosystem. Planetary health is also the recognition of the natural system, the importance of natural systems in human health. We have, yeah, experiencing climate change, and this climate change is as a result of a lot of human activities. For example, industrialization. This actually damaged the planet that we are on, that is planet Earth. Okay. And then the perspective of global health security is the recognition that you can have infectious diseases that can cause a threat to global health. And COVID-19 is just an example, okay, that it poses a global health threat that actually became a pandemic. Okay, so when we talk about global health security, is having systems that can be able to detect and respond to global health threats if they emerge. So having learned all the things about environmental health, how can you apply it? Of course, the decision makers need to first understand that One Health is what One Health is and how it can actually be applied to improve the health outcomes of populations. So that that One Health element comes in how we frame, prioritize, even determine what decisions we make at the policy level. Okay, so that understanding comes first. If you understand, then you'll be able to um, uh, formulate policies that incorporate elements of One Health. So that is where you have policies that are not made by one department, or health policy that is made by the Ministry of Health alone, without the involvement of the Ministry of Agriculture, Ministry of Irrigation and Water bodies, whatever it is, and all that. Okay, so from policy generation to policy implementation up to evaluation, it's very important that you have that recognition that you can apply these principles. And then at institutional level, and this is what I want to emphasize. If you look at the organizations that you're working in, and look at the health problem that you're trying to address, how is your organization aligning with One Health approach? Or you're addressing the problem in what we call silos, where this is actually what is happening across, that problems are addressed in a silo manner. Okay, so institutions should be able to implement some of these things. And for us as an institution, actually, that's why we are teaching this. And that's why we are going to incorporate it in our curricula. So it's such that One Health is something that you really understand and can apply. And then in your daily activities at the operation level, you can also apply the principles of One Health. For example, we talked about the systems thinking, okay, which we say that you look at the whole picture. What are the different parts that contribute to this problem, and how can you be able to address it? At an operation level, you can be able to do that. You by this time, I'm quite certain that perhaps you have bought in on the idea of One Health. So the question should be, if One Health is a very good approach to solving this problem, why is it that it is not actually working? It's not actually being implemented, rather. The issues are, like I said earlier on, very few people recognize the value of One Health. Perhaps it could be very difficult to implement and coordinate, actually, if you don't have systems in place. Like, for example, we said that there should be platforms for sharing information. At the moment, it's quite hard. We don't have that yet. Okay. So we have different NGOs trying to solve different problems in a way that they think is appropriate. Okay. It is also one of the funny thing is that you can talk with a government official and then they say, you see, this organization is doing this, but I'm not comfortable with what it is doing. Okay. So we have this fragmentation, which is basically that everyone is doing what they think is right, other than coming together and say, "Look, what can we really do to solve these issues?" There are no coordination mechanisms. People have different interests, different agenda, and different incentives. A doctor is interested in treating that patient who has come to the clinic. A public health person, their interest is to see that the person does not fall sick. The saying that goes that if you have a person going to see a doctor, and that means public health has failed. If public health has been successful, then the patient should not be able to go and see the doctor, because the malaria will not be there, the typhoid will not be there, the diarrhea will not be there. So if you solve the issues to do with that cause diarrhea, then the people will not get the diarrhea and they will not come to the hospital. So you have different perspectives on how to deal with health problems. The doctor will feel very happy if the child who was brought with diarrhea and he is dehydrated and has been rehydrated, resuscitated, and is actually okay. And the doctor will go home smiling. The public health person will not be very happy with the fact that the child actually got this diarrhea. Okay. So different the way, actually even the way we train, and I think One Health is an approach that actually use a lot, and some of you perhaps have not noticed. When I'm communicating about different lectures, I said this lecture is for healthcare students, but it is very important for public health students. And then, of course, the reactions sometimes are that, okay, should we attend, or I'm doing this course, should I attend it? Of course, sometimes I'm reluctant to say don't attend, because my thinking is that, you see, you never know where you will apply this knowledge. A reproductive health person should have knowledge on how a public health person addresses problems. Okay, you have a nutrition problem, let us say acute malnutrition, the prevalence is very high. A public health person will have a way in which they deal with that problem. So if you're a nutritionist and you don't know how a public health person handles such problems, then there is no way you're going to actually invite them to have a conversation on how to address some of these problems. Okay, so even the way institutions actually teach should foster One Health. Okay, in the project that, for those of you who joined earlier on, I told you about a project we had at Makerere, where we went to a community and implemented a One Health project. We were students from different courses: dental surgery, medical radiography, pharmacists, public health, nursing, veterinary doctors, all of us in one place and going and investigating the problems of that community. Okay, so the way we train, we should have sessions where we actually share, where these different students from different courses actually come together to discuss some of the problems that we face. Limited resources and capacities, legal, ethical, and cultural barriers. Okay, and then the other one is publication systems and language barrier. The language spoken by a nutritionist will be different from a language spoken by a healthcare manager. If you use a lot of jargons, then no one will understand one another. Okay, when you tell a healthcare manager about BMR or about body mass index, BMI, they will not really understand you unless maybe they first Google. Okay, so there's that language difference. Then the other issue is publication, different publication systems. This is where you have journals that publicize nutrition, journals that publicize public health research articles. So for you as a public health person, you're not interested in knowing what is happening in nutrition. Yet, if you knew what is happening in nutrition, you could be able to understand how that problem could be solved. Or you can actually offer advice on how a particular nutrition problem can be solved. Okay. And then the other issue is that this research is not readily available to everyone. Okay. Perhaps if I'm in public health and I'm interested in something in nutrition, if I can access the information in nutrition for free, it could be okay. But I will need to pay money to access some of the information in the Journal of Nutrition. So you have these problems of publications. All right. And then lack of incentives, motivation, and support to adopt One Health, and approaches, lack of trust, respect amongst different disciplines. The one I talked about, the difference where you have doctors over dominating and then the other professionals being behind, laying back. Issues to do with governance at policy level, all those contribute to the fact that One Health is still not being used. So how do we address the problems? There is, of course, need to engage, to talk to one another, the policy makers or the decision makers, the funders, such that we can raise awareness and educate people about the importance of One Health, such that there are clear goals, responsibilities, roles, objectives that we can really anchor our interventions on and be able to increase interest in using One Health approach. Okay, so it is also very important to really conduct or even have strong laboratories to really do a lot of this testing and such that you can really convince people based on evidence that you have collected. So increasing surveillance systems is very, very key. Okay, so it has been a marathon. I guess you have been following